938 Live. 938 Live gets you talking with the Breakfast Club.
Did you know that bone loss where teeth are extracted can lead to shrinkages in your upper and lower jaws? And this may finally lead to a collapse of your lips and cheeks and an eventual appearance of premature aging. Well, one way that this can be remedied is through the option of bioscaffolding. The tiny device is placed into the hole or the socket left by the tooth. It helps to promote bone growth, which is important for tooth implants later on. Implants need a bone base to hold them steady, and the bioscaffold also helps to prevent the hole or the socket from collapsing. What exactly is bioscaffolding, and how does it compare to surgical bone grafts? We're joined on the line this morning by Assistant Professor with the Faculty of Dentistry at the National University of Singapore, Dr. Victor Fan. Good morning, Dr. Fan.
Hi, good morning.
Now, Dr. Fan, why would this situation occur in the first place? Why would someone need a bioscaffold?
Okay, teeth are quite necessary for functional stimulus of the jawbone, and it actually helps to maintain bone levels in the mouth. When the tooth is extracted, the functional loading from the normal chewing and the biting that we do is gone, and then this will result in a loss of bone, which is what we call resorption. So studies have shown that the socket height can decrease as much as 2/3 to its original height. In the first 3 months or so, up to 50% of this can be lost. So when you lose a tooth, you actually lose the bone height because of resorption.
So, Dr. Fan, I'm trying to get a picture of this. Is it similar to when you do a root canal, they put these little rods in your tooth and then solder it down?
Oh, no, it's totally different. We're actually talking about entirely different thing now. If you root canal, you're trying to save the tooth. With this, patients who need to lose their teeth, for example, for whatever reasons, will need their teeth extracted. We're trying to preserve the bone after the extraction.
Right, okay, but you wouldn't do this in every single case, would you?
No, I think most of the patients who have teeth extracted would be suitable to have a scaffold put in, unless, of course, they have very bad gum disease, or, in fact, there's lost a lot of bone, actually.
Okay, so tell us more about this bioscaffold. How does it work exactly?
All right. Bioscaffold is actually a sort of a tissue engineering device, really. We are really talking about a structure that forms a three-dimensional shape to allow body tissues to grow into it. And it itself has to be so-called biodegradable, hence the word bio. So it's actually taken from the word called scaffold, like buildings. When you put a new building, you allow workers to climb on it, right? So the little scaffold structure. So what the scaffold does is it provides a structure for the bone to grow onto it. So in these cases where people have the teeth extracted, as I told you earlier on, you tend to lose a lot of bone. So by putting a scaffold, you help to prevent this bone loss.
Okay. When you do get a tooth extracted in adulthood, sometimes the dentist will tell you, put a bridge there. Is this, a feasible alternative, perhaps? Yes.
Of course, after you remove the tooth, then the bone will have to heal first, then you put a bridge on, right? So, but now, with the advent of dental implants, it's probably, the best mode of replacing a missing tooth. With a dental implant, you actually implant a metal or titanium structure into the jawbone. So that involves bone, and you need bone for it. So with a bioscaffold, what you do is when you have the tooth removed, you put in a scaffold, you preserve the bone level, and the dentist can put in the implant for you.
How much would all of this cost? How much would this set me back, the bioscaffold in particular?
Okay, in the National University Hospital, I think the charge is about $100 to $200 per application. I think a lot of dentists outside do charge it together with the extraction package. I'm not exactly sure, but it may range from $200 to $300 or $400.
So you would recommend this after every tooth extraction? If
the tooth is actually extracted because of caries, that means there's no drastic infection and no bad gum disease, then, and especially if the patient is planning for a dental implant, then it's reasonable to actually put in a scaffold to preserve the bone height so that dentists can get a job done easily. If not, you might need bone grafting if you have lost some bone there.
What is bone grafting like? I understand that that was what was being done before.
Yes, that's right. So in the past, where this method, so-called alveolar preservation, has not been very well used because, it involves surgery and all that. For bone grafting, what happens is that you have lost a bone and you want a dental implant, for example. Then you need to put in back some bone. That's what grafting means. At the present moment, when you do grafting, you can actually take the graft from the patient's body, like from the hip or the pelvic bone, or from some place else in the jaw. So you need to do an operation somewhere, get some bone, put it back into the jaw. So you have actually two operation sites. There are also, of course, what we call artificial bone, which in the form of really calcium material, and it can be taken from cows or pigs. But these grafts are not as good as the patient's own bone, and there's a slightly higher risk of infection and them not taking.
Okay, so Dr. Fan, after doing this, does the scaffolding need to be removed, like the skeleton of a building after you put the scaffolding and you take it down,
No, you don't have to. That's why we call it bioscaffold. It's bioresorbable. So the whole idea is this: you put a scaffold, you help the bone level to go back to where it was as naturally as possible, and then the scaffold on its own is bioresorbable. It dissolves away on its own in a couple of months, really, 4 to 5 months.
And of course, this would be permanent. I mean, is there a risk of the bone perhaps again degenerating at some point?
Yes, of course. I mean, certainly there's nothing permanent in the human body, I'm afraid. The bone itself is always undergoing changes, right? So for a person who goes through, life, your bone mass can get lesser, right? So the same thing can still happen. But what we are talking about is really prevention of the bone loss in the immediate extraction period, whereby, let's say, a person wants dental implants. So the loss of 1 to 2 millimeters of bone can mean a lot for the person, because it may mean that it cannot be suitable for implant anymore, and you need to have bone grafting, for example.
Right. Now, can anyone opt for this procedure, or are there contraindications, perhaps?
All right. If a patient is generally healthy, it's not a problem at all. For patients who are diabetic, we have to see if the tooth itself is, to be extracted, there is the socket side, whether there's any sign of infection. As long as there's no sign of overt infection, it's not a problem to have this scaffold, because this is actually a material which is called PLGA. It's actually a material used in what we call a dissolvable stitch. It's very well used in the human body now, perfectly safe, non-toxic. As long as there's no overt infection, the scaffold can be placed in the bone.
All right, sounds great. Thank you very much, Dr. Fan. That, of course, was Dr. Victor Fan, Assistant Professor with the Faculty of Dentistry at the National University of Singapore, telling us more about bioscaffolding, something that you should opt for when you get a tooth extracted. Otherwise, it could lead to a collapse of lips and cheek support, eventually making you look kind of old, even though you're not. Thanks so much, Dr. Fan, for telling us more about that. Stay with us on Fresh.
938 Live. 938 Live. Gets you talking.